So we're going to talk about a few things. We'll go through quickly about Creative Councils and the webinar series. We will talk about why develop a business case. We'll look at some of the tools for making the case. I'll link you to some existing evidence. There'll be practical steps you can take. And then we'll talk a little bit about using the results, and there'll be Q&A. But throughout this, I want to make this interactive. We'll run some exercises. We'll ask for some interactions. And next step, in the very next section, I'll actually ask for some of you to comment on a few things. So if we start off with this, so this is the fourth of the webinars around Creative Councils. Involve has been commissioned by NESTA to help provide engagement support for the Creative Councils project. We're very excited by that. It's a great program. So this webinar is part of that provision of support to the Creative Councils, the 17 Creative Councils, but also to the sector more widely. Interesting topics. We've already talked about where next for engagement, about elected representatives and participation. We've talked about community positive deviance. We've talked about quite a number of different topics, and they're all recorded. They're all available on the Involve website. So there's a backlog there. If you haven't had a chance to look at those, I'd really recommend them. They've all been excellent, and hopefully this will be another great addition to the recording. So if you have to leave at a certain time, this will all be recorded and all available on the Involve website. So, Creative Councils is a NESTA and LGA Challenge Prize, which is currently supporting 17 councils across the UK, with a real focus on radical engagement to solve problems. And I'm really excited to be working with the program because it's such a diverse range of really interesting councils tackling issues like the aging society, sustainable growth, children in care, sustainable transport, all across the board. It's a 2-year program, some really interesting councils and some really interesting projects. And as part of many of these councils are obviously doing community engagement as part of their projects, and so we're there to support them and the broader sector through these webinars, for example. So they'll be every 2 weeks. They're on Friday around lunchtime, so you can fit them into your busy days. And we'll be running throughout April. And feel free to invite colleagues to them. We're hopeful that we'll get rounds of it. A little bit about Involve. We're a charity based here in London. Our focus is on connecting governments and the people they serve in new ways. We work across the board with health, local government, central government, international bodies. And we provide a lot of practical advice through, for example, People and Participation, our practitioner website. Really well worth a look if you want to know more about practical methods of participation. And of course, our publications, the Involve website has 7 years of publications, how-to guides, and research, all available for free. So check that out if you have a chance. Let's move on and talk a little bit about public engagement. Now, a lot of us have issues with money. This is especially true for community engagement practitioners. And this is a quote. We've been looking at public engagement and valuing it since 2005, and this is what we heard back then, and I'm sure it's equally true now. A lot of people are very uncomfortable about when you start talking about a business case for public engagement. A lot of people feel that you shouldn't put monetary values, you shouldn't be asking these kind of questions about public engagement. And I can sympathize with that view, but I disagree with it. But let's look at that a bit more. And I'd like to open up to the participants that we have now to see, well, how would you make the case for public engagement and public participation? What are your arguments? And you can either write them to Annie, or if you have one, just let Annie know and she'll unmute you and you can say, so what are the ways in which, what are the arguments you use to make the case for community engagement and public engagement at the moment?
The easiest thing to do actually would be just to put your hand up and then I can unmute you like that. There aren't any hands up yet. Oh, here we are. We've got Gary McGrow. Hi, Gary. Can you hear me?
Fantastic.
Hi. Yes, I can hear you. Hello.
Brilliant, Gary. So, how do you when you're faced with colleagues, skeptical colleagues, what do you do to make the case for public engagement?
I think the case to be made is really highlighting the benefits and some of the outcomes from engagement as well. But also what we've done probably about a year ago, working within the NHS within Scotland, is highlighting the benefits towards our healthcare quality strategy. So how would engagement, participation in the health service actually meet those strategies' objectives, if you like?
Yeah, brilliant. So you're tying into what's already going on and making very clear how that benefit relates to people. Yeah. Very good. Yeah, I found that's often really useful. So what else?
Case studies. Case studies are good practice. I've tried to look at the economic benefits, but there's not enough evidence, particularly here in NHS Scotland.
Now, the economic benefits are quite difficult, and we'll get onto that in a bit. How do you deal with that? But I think case studies are also very compelling if used in the right way, and you're able to get them out there and understood.
Yeah,
absolutely. So anyone else with anything to add to that? Any other hands, Annie? Okay, I'll take that as
I think
no.
That's it for now, yeah.
I mean, a lot of the time, not make the case for public engagement. We've often focused around non-monetary benefits. We've said it's a good thing in itself, it's a democratic right, it improves well-being, it includes marginalized groups, it empowers marginalized groups. These are all true, and these are all very strong arguments for why we should do public engagement. And the problem we're facing right now is that we have moved into a situation where making some kind of monetary argument has become important. That doesn't mean we have to put cost and benefit, a value on everything around public engagement. But we have to be able to start articulating why it is a good thing to do beyond these intangible reasons. And why? Well, we've obviously got the cuts agenda. We've got the massive cuts going on in the public sector. And there's a lot of very good work that's happening that people are unable to defend it because they've never really thought about how do you make a case for this in the context of rapidly declining budgets. There's also an argument to be made that actually because we're doing engagement with taxpayers' money, we owe it to the taxpayer to make sure that what we're doing is actually worthwhile and the best use of that money. It can also be a great exercise for clarifying what you're trying to do to both internal and external audience. And of course, for me, one of the big reasons for actually looking at the articulating the benefits of engagement much more clearly, is that at the current time we're so focused on short-term savings. Are we saving money in the short term? There's a lot of projects that will give really substantial savings to the public sector in 5, 10, 20 years' time. That will really make a huge difference to whether or not society and our public services are sustainable or not. And those programs can only be done if we're able to actually put in words, clear words, why those things make sense in the longer term. So that's the reason I think business cases are so important. And this, again, is something from our research. The truth of the matter is, especially when you're talking about monetary benefits, but also many of the intangible benefits, we just don't know, and also the costs. There's a sense of there's this void. We just don't know how much we're spending on public participation, and we just don't know exactly what it's producing. Which surprised me when I started working in this field. I always thought the costs would be easy to find, but actually we have no idea. Why is that? Well, to a degree, public engagement is still a new field, so it's still developing. Academics haven't really taken the time to fully immerse themselves and look at this with the same rigor they have other fields. It's also that many of the benefits that you get from engagement are intangible. They're things like increased citizen confidence. They're things like increased trust. There are things like improved service outcomes that don't directly translate into a monetary benefit. Also, the benefits are often distributed over time across a wide range of people, and more importantly, also perhaps across many organizational budgets. So the benefits that a local authority process produces might be reduced use of health services or reduced crime, benefits which aren't actually tracked necessarily by that local authority. It's also very hard to unpick the costs of engagement because often engagement is done as part of a broader role. A civil servant or council officer will do public engagement as part of their bigger role. They won't necessarily track how much time they're spending on engagement particularly. It's also quite unclear what is cost and benefit in many cases. To take, for example, when you're doing a consultation or an engagement exercise, how do you count the participant time? Is that a cost or is it a benefit? Now, an economist would probably say, well, it's a cost because there's an opportunity cost. If you spend your time going to consultation meetings, you're not doing something else, and that other thing might be more productive. So there's an argument for why we should count the cost of people participating in the consultation meetings as maybe as an expression of the minimum wage or the average wage or something like that. Of course, the problem with that is that it leads to an incentive whereby we want to have as few people taking part as possible, which makes no sense. And also, you could flip it on its head and say, well, actually, the participation of individuals themselves is actually the benefit that we're looking to produce. We want to have active citizens. We want citizens to take an interest. We want citizens to actively influence decisions. And so we should count it as a benefit and not as a cost. Of course, that, when taken to its extreme, is also counterproductive because then we have an incentive to have as many people as possible, even when that doesn't make any sense. So that's another reason why we know little about the benefits of public engagement, because it gets very complicated. And the final reason I'm going to mention here is that I think a lot of people over the years have been quite fearful about being honest and upfront about how much public engagement costs, because they've been dedicated to the work and they don't really want people to find out exactly how much it's costing. And we've found that in speaking to some, if not all, practitioners. So let's look at economic evaluation. This is what we often think about when we talk about measuring costs and benefits. So these are quite rigorous academic processes. So cost-benefit analysis is the most common one. And this cost-benefit analysis is when you take, and by the way, apologies for this kind of burst of theory. This won't be the whole webinar, I promise. I'm just going through it all so we've got a shared understanding. So cost-benefit analysis is when you have all the costs and all the benefits are translated into monetary terms. And you compare the two and you say, well, this is what we should we or should we not do this? And since you've, in theory at least, transferred all the costs and all the benefits into money, you can say with a high level of certainty whether or not it's worthwhile. Cost effectiveness analysis is where you don't actually you're not able to turn the benefits into costs, into money. So that might be, for example, you're doing a program around public engagement with a view to increasing educational attainment. And you might not be able to put a monetary value on the educational attainment, but what you can do is you could look at the number of children who get a certain number of grades. That will be your effectiveness analysis, and you would then look at different programs, different ways of engaging young people, and seeing which of these leads to the most cost-effective approach. So which one gives the most number of children passing with going through certain grades at the lowest cost. So it's a cost per unit analysis. You've got cost minimization analysis, which is one we're using a lot nowadays, which is just to see which option gives the lowest cost without actually considering the level of benefit. Cost consequence analysis is a complicated version of cost effectiveness, so essentially where you might acknowledge that in a program you have multiple things you're looking to produce: lower crime, increased social capital, increased trust. And so you'd measure the cost per unit of each of those. And finally, social return on investment is a version of cost-benefit analysis, which and cost-benefit analysis, and this is where basically where you look at a social program, for example, looking to get people back into work, and you look at the return on investment, which means for every pound I spend on this program, do I get back in terms of social value? And the New Economics Foundation have done some great work where they've shown, for example, some work in Liverpool where if you invest £1 in a program, you get £10 back in terms of reduced unemployment, increased skills, increased earnings, etc. So that's an interesting way of presenting the results. So these are all quite academic, quite robust, quite complicated evaluation methods. And that's often why they're not suitable for use by practitioners. And that's why we'll move from talking about economic evaluation into talking about business cases. So evaluations tend to, these types of economic evaluations tend to be quite academic. They tend to be complete in terms of trying to capture everything. They're quite time-consuming. They're looking to establish the truth in some shape or form. And it's important that all the data is rigorously measured, captured, whereas a business case is much more practical. It's a much more practical document. It acknowledges that it's often incomplete, that you're making some pretty big assumptions about how it's calculating things. It can be done in the time you have available, up to a point, and it's not necessarily about uncovering the complete and utter truth. It's about looking at information which is good enough to make a decision around. And that's a much more feasible and doable option for people in local NHS and others. Let's face it, you need to build a business case for doing public engagement right here. You don't have 2 or 3 years to run a full evaluation. You need to build something which doesn't require the use of dedicated researchers over a long period of time. You need something that you can do alongside everyday work. So there's a number of issues here that needs to be unpicked, but we're going to focus very much on the business case. So how do you create a clear story about what the benefits and costs are that you're producing? And in some cases, that will involve measuring them and putting monetary values on them. In other cases, it will not. In other cases, it might just be about writing a compelling case study. So there's a few concepts I just want to get past you here which are important for understanding, which are particularly relevant to public engagement, one of which is public goods. Now, many of the things that public engagement produces are public goods. That means they're non-rival, which means that one person's use of this doesn't actually exclude someone else's, and it's non-excludable. It's very difficult to exclude anyone from gaining the benefits from the goods. And so one example would be public safety. If you live in an area which has low crime and where the levels of social capital and engagement mean that people look out for each other, that's non-rival. You can't really exclude me from using that, and it's non-right. It doesn't reduce your use of it, and it's not excludable, which means that you often get people. You can get people free riding off public goods. They won't contribute to them, but they'll make use of them, or people will they'll undermine them, or people just will be unwilling to pay for them because it's everyone's responsibility and thus no one's. And this often happens when you're looking at public engagement. A lot of the benefits of public engagement about building long-term social capital, about improving the results in local areas, they often fall between chairs. So why would the council pay for a program which will reduce the costs for the NHS and the police service in the years to come, when actually it's in society's benefit as a whole to do that? So a few other concepts which are worth bearing in mind, one of which is dead weight, which means what would have happened if we hadn't done the engagement. There's a real temptation when you're trying to put a monetary value on public engagement to say, well, so let's say we do a public engagement process around crime, and then crime goes down by 20%. And it's very tempting to claim that 20% for the public engagement, but actually we need to see what would have happened anyway, and we'll talk a little bit about how to do that later. So what we're really looking at for is the additionality. What effects did the engagement have once we discount what would have happened anyway? And the last thing is something I want to talk about here is displacement. And this is also important to bear in mind, because sometimes it might be that public engagement actually isn't having a positive impact. It's just pushing things elsewhere. So in crime and policing, for example, it's quite common to see cases where police up their activity in a certain area, and that and we're having some problems in the local area, as police go in, that reduces crime in that area, but the criminals simply go elsewhere, and that creates all kinds of problems. So that's worth thinking about tracking. So in short, we need to be acknowledged that when we're doing business cases, we're not going to get the perfect truth. We can enhance our knowledge and understanding, which is great, but it will always be incomplete. So just thought I'd open up for 5 minutes or so to see if anyone has any questions now that we've gone through the kind of theoretical bit. Now we're moving into practice.
Gary McGraw again.
Anyone interested?
Yes, we've got Gary McGraw again. Give me. Hi, Gary.
Go ahead.
Hi, Edward. I was just wondering if there's any examples of social return on investment, specifically on community engagement projects, that you're aware of.
The examples I know of from, for example, the New Economics Foundation they haven't had a focus specifically on community engagement, but some of the activities in the projects that they've looked at have been community engagement. So they haven't sort of sat down and said, well, let's look at the social return on investment of public engagement, but they have looked at what's the social return on investment on innovative projects looking to reduce unemployment, or projects looking to reduce fly tipping or similar issues. So there's probably things you could look at there which you can draw out from and say, well, it's been shown in other areas that this way of working is very powerful.
Yep.
Any other questions?
Doesn't look like we have any more at the moment.
Okay. Well,
all perfectly clear, Edward.
Sorry?
It's all perfectly clear,
good,
I think.
Good. So we'll move on to another cynical quote. Nowadays people know the price of everything and the value of nothing. You know, Oscar Wilde is just this bottomless source of great quotes. The reason it's a good quote is because we need to be wary about, on the one hand, I've already expressed why I think we do need to start talking about monetary benefits, but on the other hand, we mustn't let our search for monetary hard benefits mean that we stop valuing or caring about the other benefits. And many of these benefits are ones which are very close to my heart. So let's look at what is different about the costs and benefits of engagement. So what's different about cost and benefits, and what's different about engagement as opposed to other areas of public policy? Now, it's important I will make these slides available to you afterwards, so don't feel you have to take that and jot down everything. But when we talk about costs, when we involve looking at measuring costs for public engagement, we talk about program costs. So these are the costs which directly come from running the public participation. So that's your venue cost, that's your staff time cost, that's the cost of the flyers and leaflets and the online forum, or whatever you happen to be running. You've also got non-program costs, which might be additional costs which the public sector or society as a whole accrues, which don't directly relate to public participation. So that might be, for example, costs of lawyers or litigation or whatever other costs that come up around the program itself. And then you've got participant costs. And it's an interesting question whether or not you measure those. But there is something here about when you're, obviously professional stakeholders will certainly they'll be paid to take part in consultations, and so there's a staff time cost there that could be factored in. There's travel, there's other expenses for childcare and other things that people sometimes cover themselves in order to take part. And it's an open question about whether or not you include them in your calculations, and it depends on the purpose of your business case. We'll come on to that in a bit, but it's worth acknowledging that there are the costs of engagement aren't just the direct costs that accrue to you out of your budget. And that's important. When we talk about benefits, Involve has sort of clustered them into four main groups. If you think about the main benefits of engagement, it's improved governance, so increasing trust, it's social cohesion, so improving the way that people interact amongst themselves, it's the quality of services and projects, so delivering better results, and also improving capacity building and learning. And many of these we can get a much better sense of. If we then start drilling down and looking at benefits, we get things like and we start thinking about how do we measure these, well, we've got things like innovation and creativity. Engagement can give you more innovative solutions. It can help you avoid conflict, access new resources. It can allow, and these are all things that you could potentially put a monetary benefit on. You could try and track how much of these new resources and what would they be worth if you had to buy them. There's the continued development and maintenance of public sector resources if people feel ownership over them, better quality outcomes, the expertise and information that citizens give, how much would that cost to get elsewhere, increased public awareness and understanding, sharing responsibility, increased use of a public asset, and staff morale are all things that you could actually track and try to put a monetary benefit on. And then there's also the benefits that you can't put a monetary benefit on, like active citizenship, stronger communities, new organizations and structures, behavior change, and trust and social capital. Now, if you're looking to put a monetary value on a non-monetary asset, you can look at a number of things. You can say, you can see if there's a replacement cost. Is there something you could look at which would act as a proxy? You could also ask people how much they value something. Both of those are tools you can use. They just tend to be very expensive, and so most people won't. However, what you can do is you can steal the measurements that academics have done and use them in your context, as long as you acknowledge that you've done so. So that's a tool you can use. So you can ask people your real preference, which is going for a market value. You can do stated preference, which is ask them what they'd be willing to pay, or willing to pay to get something, or willing to pay to accept something. But the third one is probably the most useful one. That's benefits transfer. That's finding measurements of benefits that others have done in other sectors and then transferring them onto your project. So, for example, the Home Office have developed statistics for how much a murder costs society, for example, and I think it's somewhere in the realm of a few £100,000. And that's something they calculated about 10 years ago. Now, it's probably not the exact value of a murder in your area, because there will be socioeconomic factors or other things, but you can use it as a shorthand. So if you had a engagement project which aimed to reduce gang violence, for example, you could actually look at the number of gang-related violence and deaths in an area. You could have a comparator area, and if you can see that the area with engagement has lower levels of death, a decreasing amount of death, you could actually use those figures to ascribe some semblance of a social value, as long as you're clear about where those numbers have come from and what the limitations might be.
Andrew, can I just interrupt you?
It's not just that.
We've just got a question from one of the participants about your last slide, asking whether benefits transfers are the equivalent of proxy measures.
That's a very good question, and yes, it is. It's it might either, so proxies would be something which aren't the same but which measure it, but which are close enough to be useful. So sometimes they are proxy measures in that. So for example, one thing you can do is you could look at if part of the benefit of a participation process is you get more people to come in and volunteer and help out. So let's say you're running a library, you get community members to help in. You could look at a proxy which would be how much would that staff time be worth if you had to buy that service in without volunteers. Now that's a proxy. It's not an absolute truth, because the truth is, given your tight budget, if you didn't have the volunteers, you probably wouldn't bring in that assistant. But it does give you a proxy value for approximately what might that be worth in a market value. And sometimes at the proxy value, it is the same thing. It's just that the figures are a bit old. So I mentioned the Home Office figures, which are about 10 years old. So clearly they're a proxy for what a crime is worth today. They're not absolutely accurate, but they're good enough. And I think that's the question about good enough is what we need to aim for when it comes to building a business case, because we can spend a lot of time developing perfect measures, but few of us have that luxury today. It's also really important to look at the distributional impacts of these things, because if we just don't look at the headline costs and benefits at the societal level, we'll miss some really important points. So looking at, through Total Place in Croydon, for example, they found that there was about 200 to 300 families which they described as chaotic, which each family each year costs the public services around £250,000. £50 million. Now, that's only 200 families in Croydon, and if you were to do an engagement process and you were to track some of the benefits, it might seem very small. But if you're actually reaching some of these groups which have a disproportionate impact on society, then that can make the program worthwhile in itself. So it's just worth thinking about this. Not every participant is the same. It depends what the purpose is. It's also worth thinking about how do we take account of risks, because risks can be really important for making the case for public engagement. And there's different types of risk. I mean, one is an obvious financial risk. So you can make the case, for example, that if you don't, engagement helps reduce financial risks in some cases by making sure that we know what local people want. If we know what local people want, we'll give them services they need, and we won't end up with, for example, I'm aware of some councils where they develop youth services which then no one used. In some cases, one project at least I know, where actually absolutely no one, not a single young person, used the service which had been developed at great costs. And proper engagement up front reduces that financial risk, which can make it worthwhile. There's performance risk, the risk that public engagement might either might impact performance better, might make people more motivated, more engaged. There's reputational risks. So there's always a risk that if you don't do public engagement, you might end up doing something people don't like. There might be a blow up in the press. The council's reputation is ruined. And then opportunity risks, which is basically saying, will public engagement make us more or less able to take up opportunities as and when they arrive? And there is an argument, some people argue, that public participation makes us more risk averse and not less. So risks get even more complicated to measure things because they're not actually real things, they're the potential of things happening. We'll get on to talking about that in a bit. So let's look a little bit about how do you measure some of these benefits. And so one of the benefits we might want to look at is resilient community networks. So how will we know, if we're talking about increasing community resilience, making communities more self-sufficient, how do we find out about that monetary value? Well, one way is to look at one proxy measure of that, because you can't really measure resilient community in itself, is the community accessing more funding and volunteering time and volunteering. So you could do a benchmark study and then look at how much funding are community groups raising, how many people are volunteering, and how much. And we're having a database of funding, access, before and after engagement, timesheets for volunteers. You can actually start to put a proxy measure to how much money has come in. I mean, Blythe Valley Council, who have done a lot of work on community development, for example, they were actually able to, going back 10 years, to show that millions and millions of pounds came into the council, which probably wouldn't have come in otherwise without the community development. And that's a really powerful thing to be able to show. But to do that, you need to keep track of things over time, because if you just do a snapshot in time, it's very hard to see where it's headed. And of course, you can also look at the non-monetary values, like asking people surveys, how safe do you feel in your community, how able do you feel to deal with any problems that arise. Another benefit is increased trust, and again, that's a non-monetary benefit that can be quite difficult. So let's look at how you develop a proxy for that. And hopefully this makes sense to you. So I want to increase trust in the community. I'd also like to be able to make a case for why this is worthwhile doing in a time of cuts. And I might argue that one of the ways I could track this, if the council is spending a lot of time dealing with complaints and resolving things after they've occurred, if I can do an engagement process to increase trust, can I actually reduce spend on complaints, dealing with campaigns, etc.? So can I keep track of how much time are staff spending through using diaries or timesheets, responding to complaints, responding to campaigns, dealing with disgruntled citizens and the fallout of low trust? If I can track that at the beginning, do engagement, and see if that gets reduced over time, it's relatively simple. If I can track the time, I know the cost of the staff time, I can then do an approximation of how much money we might have saved. Then, of course, there's the monetary, non-monetary values, like looking at reported trust levels, National Indicator 4, which is now gone, of course, but looking at other indicators which show how people feel and whether they feel they can influence decisions. Another benefit, really important one, is quality of services. How do we make sure we have really good services? And oftentimes there will be specific outcomes that will be tracked anyway around health, so health outcomes, crime levels, environmental impacts, educational attainment, you name it, it'll be tracked. And if you're able to do a time study to see, before and after your engagement process, and if you're able to provide a comparator in some shape or form, you can make a compelling case for how your project made a difference, and actually using information which is there already. So it wouldn't actually necessarily entail much more work for you if those figures are gathered anyway. So what you probably need to gather is a sense of staff time, work hours, timesheets, service statistics, gather that information together, and then see how much, what claims you can make in terms of a strong business case. And obviously on top of that, you'll also want to be tracking service user satisfaction. What about the very useful but really hard to measure benefit about taking difficult decisions? Well, one way of doing this, which I've looked at, is to reduce measuring the impact of engagement by looking at conflict levels and how much you spend on litigation. And so you'd need to measure things like legal costs, how much time people are spending, complaint listings, etc. And as well looking at some of the non-monetary values, like how many negative articles you get in the press, what's the survey results showing in terms of whether or not the public trust you. Good community relations, and this is about whether or not the community feel ownership of the public assets in their area. You can things like, does this reduce vandalism and crime in the local area? Now, obviously, this is I would never say that vandalism and crime are the same thing as a level of community relations. They're just a tenuous link there. But so you could look at crime statistics to see whether or not you can track a reduction. This is helping you think about, okay, I know what benefits I want, but going from knowing what benefits you want into a way of actually tracking that, which makes sense, can be quite complex. And we'll talk about the log frame in a bit, which is one of those tools. One of the most useful ways of trying to measure costs and benefits, which is really practical, is to develop some kind of replacement cost. So ask yourself the question, if engagement gives me a new resource, what would it cost to replace that resource? So, for example, let's say we get those volunteers in to help run the library. Well, the replacement cost might be the cost of providing the service activity using paid staff. So how much would it cost to deliver that service? If you get new information through public engagement, so for example you're running neighborhood forums, and as part of that you actually develop some really interesting insights about local service use, how much would it have cost you to gather the same information using a market research company? That can be a replacement cost. So you might say, well, actually we've stopped doing basic focus groups, we're doing much more in-depth long-term work with the community, and the quality of the information we're getting, we reckon we'd have to run 10 focus groups to get that quality of information. Each focus group valued at about 2,500, and so there we're looking at £25,000. That's the value that we get by doing it in-house through this other method. New and improved relationships. Well, is there a way of thinking about if we tried to do that or increasing the public awareness, both of those things, you could look at, well, if we tried to achieve that result using a PR company or marketing, have we done that in the past? How much did that cost? So there's replacement costs. It's worth thinking about, if there's something that engagement gave you, what could you do instead? What's the replacement? And can you put a monetary value on that? So now we move into the area of actual tools of engagement. How do we actually measure these things? We've looked a little bit at the benefits. I'm going to give you some of the practical tools that are useful. So one of them is the log frame. Now, some of you have probably used the log frame. It's a very useful evaluation tool. It's been developed originally in international development, and it helps take you from a vague sense of purpose, what you're trying to do, into developing actual indicators and measures and data. So it starts with the goal and purpose. What are you trying to do? Moving on to the indicator. How will you know if you're successful? Can you and then looking at actual monetary measures. Can you estimate a monetary value of any of the indicators? How do you get the information? And what are the assumptions that you're choosing in measuring success in this way? So let's do an example. If I'm trying to go on holiday, my goal and my purpose is to relax. I probably can't measure my relaxation levels exactly, but how will I know if it's successful? Well, I'll probably be on the beach. And obviously, can I put a monetary value? Well, actually, I can put a monetary value on my holiday, so it's a very bad example in this case. So let's move back and look at the public engagement example. So if we're trying to engage, if I'm trying to increase, the health outcomes for a local community, how will I know if that health outcomes is very vague. How will I know if I'm successful? Well, I'll actually know that there are a few benefits. There are a few particular conditions like heart disease, diabetes, that I'm particularly worried about in this area, and I'll see those decline as people self-manage better. Can you estimate a monetary value on any of those indicators? Well, actually, I can. By going to the Department of Health, by going to the health literature, I can find approximations of how much it costs to keep someone in, how much it costs every time someone who has, for example, diabetes has to be admitted to hospital for not managing their issues properly. Can you gather that information? Well, yes, you probably can. That information is available in, that's probably is gathered by hospitals and other places. You just need to access it. What are the assumptions I'm making in choosing this success measure? Well, firstly, I'm assuming that the statistics are accurate, that there aren't a large number of people who are suffering in silence, so to speak. I'm also assuming that there is a. I'm also assuming that the health measures I have chosen are the ones which actually matter to the local community. They might not be. It might be actually that the respiratory disease is a much bigger problem in the local area, or that the people really care about other quality of life issues. And the reasons we have the assumption column is it's really important to ask ourselves, what assumptions do we make when measuring success? Because otherwise we might be led down the wrong track. For example, it's often the case that people assume that certain things are positive outcomes. I mean, a typical example would be a lot of people are very obsessed about bums on seats when it comes to community engagement. So you might say, well, I want to increase the level of active citizenship and trust in public engagement. Well, what would be an indicator of that? Well, lots of people will show up to my meetings. And you can gather that information very easily, but there is a basic assumption with that. And you're saying that a large number of people at meetings equal trust. And if you think back to your own experience in running community meetings, which meetings are often very well attended? Well, they're often the ones where there is no trust between the citizens and the public services affected. If you've messed up your bin collection, or the hospital has had a series of unnecessary deaths, you run a public meeting, you'll get huge amounts of people. So there's an important assumption made there which might not be true, and which you need to think about, so you're not actually measuring something which doesn't serve you. It might also be that it's this thing about sometimes we assume that there is a certain relationship between certain measures and a certain outcome, and in fact that might not be the case, because we've decided how those two link together. So I wonder if anyone has an example of an outcome that you're seeking to develop or seeking to get that you'd like to talk through as a practical experiment? We could try out the log frame, see how it works, and you'd get a real life case study. Is anyone interested in that?
You can just put up your hand if you think you have an example.
It'd be great to just have a real life example, something you're working on right now where you're struggling a little bit about how to measure the benefit that you're producing.
I think we're a bit shy, Edward, so far, or struggling to think of examples.
That's fine. Do you have one, Annie?
Ooh,
put you on the spot.
Put me on the spot. You have. I've prepared a question, but I haven't got an example. Let me think. So we're looking.
No, but have you been involved in any projects recently and looking at benefits? So let's look at local. The Brixton pound, for example, Annie.
Yeah. Let's do that one. That works.
If we took that one as an example, because I know you've had some experience of working with that. So what's the goal of the Brixton pound? One of the goals. Pick one.
Well, quickly, for people who don't know what the Brixton pound is, it's a local currency that you can only use and spend in Brixton. So if I had to pick one goal for it, it would be to increase local business.
Local what?
Local business. So amounts of money spent in local businesses as opposed to big chains.
Brilliant. So the goal is to increase the spending on local business as opposed to chain. So what's an indicator of that?
I guess, first of all, the amount of money that passes from customers to local businesses, so we can ask them about their takings.
Yep. And is that something you can measure monetarily?
I suppose it is.
It is, because it's money, which is great.
But it is
and
hard
how would you
to
get
tell.
the data?
It is hard to tell, I suppose, whether that's because of the Brixton pound. So there's obviously, in an area, an issue as big as people's spending habits in Brixton, there's lots of different influences there.
Yeah. I mean, I'd say when you're looking at that indicator, obviously there's two things you really need to do. One is you need to have a baseline and then compare it over time.
Yeah. So
you need to know where did you start out before the Brixton pound or at a certain point, and then where did you get to once the Brixton pound came in and started working. Because you won't know how much of it is spent, and you'd also need to know how much of the money in local. So let's say we look at how many people spend money locally on local goods rather than the big chain stores. And even if we see an increase in the spend, we'd have to look at how much of that is actually Brixton pounds, because if none of it is Brixton pounds, then it's hard to prove that. It'd be hard to make any claim that the Brixton pound has influenced that.
Yeah.
So what this is showing is that actually to make a compelling business case, you have to have a comparator, you have to have a baseline, have to have something to compare with so you can make a meaningful statement about how things are moving. So that's, and are there any assumptions in that we're making in looking at it this way, Annie?
I guess there's a values assumption that it's good to spend money in local businesses, and that they are more sustainable or more ethical than chains.
Yeah, absolutely. That's a really important assumption to look at. Another assumption another important assumption might be to look at what do we. We're assuming that people then are spending them in local businesses and not hoarding the money, which sometimes happens.
Yep.
And we're assuming that the local businesses will then go on and spend their money locally, as opposed to moving it elsewhere. There's things like that which are always worth checking.
Yeah.
So it's an interesting exercise. If we look at another case, for example, I don't know if anyone now has another case they would be interested in looking at, a challenge you're faced in your work right now.
If you think of something, you can type it into that questions box, and we can always come back to it later. Oh, we actually have got a hand up now from Corinne.
Oh, fantastic.
Hi, Corinne.
Hello, can you hear me?
Yes, we can. Yes.
I run a diabetes user group a regular diabetes user group in inner northwest London, and we're obviously trying to influence and improve the services, but how do we separate out the effect of the other health changes going on? And obviously there are measures of sort of attendance at clinics and hospital admissions, but it comes back to the same question of separating out the effect of the user group.
That's a really very good question, and there's not an easy answer to that. So if the purpose of the user group is to, so would you say it's to improve the quality of care, the results that are coming?
Yeah, to improve the diabetes services.
Yeah. So obviously possible indicators there would be all those health statistics that we mentioned earlier, in terms of admissions, in terms of, both actual, so hard measures, but also self-reported. And you can put monetary measures on them, but you've really put your finger on something really important, which is how do we, the assumption then is how do we, that it's the user group which is having the impact and not the other changes that are going on in the health service. And that's really important also as an insurance policy, because sometimes you go in with the best possible will in the world, aiming to improve things, and things get worse. And that can be very disheartening. But you need to understand what else is going on in order to look at whether or not that's actually due to your business, or if you're actually perhaps making things, it would have been worse without your work. They actually would have gone down further than they have, and your work has actually helped to improve things. So looking at that, there's a few things you can try and do. I mean, one would be to say, well, are there other areas, similar areas, which don't have that kind of user group that you could use as a basic comparator?
Yeah.
Are there ways of trying to track in a smaller subset of patients to see if the patients that have had an impact, that have worked through the user group, have different impact, have had different outcomes? Another way of doing this, which has nothing to do with monetary things, is to actually ask the decision makers themselves, to what degree do they listen to, do they notice, are they aware of the user group's existence?
Yeah, that's very valuable. I think it's important that we're not looking at just the effect on the health of the members of the user group, because if that was the case, it would be a very expensive expenditure just for a small number of people. But yes, definitely, the decision makers themselves, that seems to be an important measure.
Because that's an important part of the business case, is being able to show that the people in positions of power are aware of the user group and that they are actually taking account of its decisions. Because if you can't show that, then it's very hard to show how the user group is a worthwhile endeavor. So it all comes back to the purpose you have for a group. In the case of a user group, it is to influence. In the case of other forms of engagement, it might be to gather better information, it might be to deliver services more effectively, it might be to communicate more effectively. And so basing on the purpose, you know what questions to then ask. But looking at the case of the user group, for example, there's subjective measures, like do other patients who aren't involved in the user group, are they aware of the user group's existence? And then there's actually hard measures, like how do people rate the quality of their care, and what is it in particular they talk about? And if you can point to particular reforms which your user group has instituted, you can then look for mentions of that in the qualitative feedback you get from patients. So that to me would seem to be one of the better ways of trying to capture this, because you're right, the public sector is a confusing field at the best of times. And in health at the moment, things are so up in the air that it's very difficult to unpick exactly what it looks like and what is having an impact on what. But thank you for that example, and thank you for sharing one which is quite challenging and brings up a lot of the kind of real issues that everyone will face when they try and apply this in real life.
Thanks.
Any other examples?
I think that's it for now.
Okay, we'll move on. And there'll always be a chance to come up and bring other things as we go along. So an example here, one increase responsiveness of services following public consultation. So indicators would be, if you're successful, one of the things we'd want to see is a change in the number or types of complaints about the services. Obviously, you can keep track of the people responding to complaints. There's a monetary value there. It can be quantified. You can record the number of complaints per month around this serve and assess it. And of course, one important assumption is that the timesheets are correctly filled in. Doesn't always happen. People sometimes fudge numbers. And actually, this is actually a very interesting example, because there is another assumption, which is basically that good engagement will lead to less complaints. And actually, in certain specific cases, it might actually lead to more complaints. If the public have virtually no trust in a public service, they might not even bother to complain. And if you start to engage them and they start to feel like there's some point, the complaints might actually go up in the short term. So there's some interesting dilemmas there that we need to bear in mind when we're measuring costs and benefits. So I've mentioned comparators a number of times, and I really think it is important that you can do a business case just looking at what you've done and what you're doing in your local area, and without worrying about other things. But business cases become much more powerful if you have comparators. The most basic comparator is to do a kind of do nothing. So what's it like right now in time, what's happening right here, and then compare it to where you got to with the project. That's giving you a time comparison. So compared to a year ago, we're here now. Of course, the problem with the whole compared to a year ago, we're here now on its own is the real world has changed as well. In the case of health, the changes in the NHS have had a huge impact. In the case of local authorities, the cuts have had a huge impact. And so it's hard to untangle whether or not the benefits or changes you've seen through your program are due to the program or just due to the world changing. How much of it would have happened anyway? Another option is to try to look for a status quo option, which might be to find another local authority or health trust area that's similar in terms of engagement levels, in terms of social demographics, etc., and where they don't do this kind of engagement, and that over time. So if you know, for example, so there have been some studies done looking at crime, for example, where that's going on with communities, similar levels of crime, similar demographics, were TV, and they found that the crime and further areas where the community engagement was happening that did in the areas which just had CCTV. Another option is to compare different engagement methods. So what's the difference between running participatory budgeting in one area as opposed to another form of engagement in another? And then, of course, you've also got the option of doing replacement costs, so alternative means of achieving the benefits. So in the case of the user group, it might be that if the user group is providing valuable insight into how services are being delivered, what would be the replacement cost for that? If you went to a market research consultancy and asked them to run focus groups or something similar to get that information, how much would that cost? How does that compare to the cost? So, for example, I know that we did some work looking at the case study of Camden Council, who did a citizen-led mystery shopper. They had citizen-led mystery shoppers. And the comparison there was noting that this was run by volunteers. This was around disability. It was run by council staff, and it was cheaper to run than it would have been going out to a market research consultancy. So there was a replacement cost that they could use as a comparison. So looking at another example, which is from some research we did in 2005, English Nature was doing some work in the Humber Estuary around legal protection, and they had a comparison which was the last time they'd done engagement. They'd just done basic consultation and it had all gone badly wrong, there was hostility. After a year, the plans were withdrawn. The legal fees that they got were actually £75,000. So there's an example where the comparator was actually what happened before. And so there, what they did is they then look for examples where the conflict, you know, that you've got the £75,000 as a benchmark. If the engagement leads to the plan going through and it costs less than that, then that's the benefit that you get. Conflict can be extremely expensive, and this goes back to this point about distributional impacts that we mentioned earlier. So DEFRA and the Environment Agency mentioned that about 5% of all the permit applications that exist took up over 500 hours of work, and over 1% took over 1,000 hours. So there's a small number of cases which have a disproportional cost, and if you can get something, if you can do engagement on those cases, you can identify them and deal with them, you're actually able to really show a strong benefit. So in the case of the Environment Agency here, they did a quick calculation where they said, well, you've got £50,000 in staff costs, 8,000 for PR and display, 5,000 admin, 2,000 postage, travel 1,000, press briefing 1,000, and the legal costs were 75,000. So they saved about £7,800. Now that's not including the non-monetary benefits. Rather than having to take stakeholders to court for a year and fight it out with the lawyers and not get the plan through, they were now able to run the plan, get the plan through, and develop good relationships with those stakeholders. So this is just one example of how you can actually put some monetary measures to see how is this worth doing. Now, obviously, the tricky thing here is to make sure that someone's actually recording how much legal time is being spent, how much that is worth. And I've found that that can be surprisingly hard to find. So we talked about tools, and now let's look at the specific Involve toolkit that we've developed to help you make a business case, which I hope some of you will take away and make use of after doing this webinar. I really like this George Bernard Shaw quote, because it's pointing out that actually what we need to do is, this is a continuous process. It's not about making a business case once. It's actually about using the business case as a way of challenging ourselves to improve what we do. What was good practice 5 years ago might be outdated now, so it is worth looking at. So the toolkit I'm talking about is making the case for public engagement. It was developed with consumer focus, and it's a very practical document which tells you about how do you measure a business, make a business case, what are the proxy measures for crime, for health, etc., that you can use if you want to put a monetary value on some of your benefits. So here's an interesting example, for example, the Heartland Community Voice project in Portsmouth, where they saw a reduction in bin fires compared, so this is both in time but also compared to other areas that didn't have this partnership structure. And the Home Office have estimated that each case of criminal damage costs £856. They also estimate that there's about 4.29 crimes unreported for each reported case. That's really important because when you're estimating the costs of crime, you have to factor in the costs of the crimes that happen but that aren't reported as well. So potentially there was a saving of almost £70,000 per year in those reduction in bin fires. But then, of course, on top of that, you've also got the non-monetary benefits that you can't put a price on. Increased volunteering, level of satisfaction. So in this area, they had over 2 years, they had the satisfaction, public satisfaction in policing went from 50% to 75%, and the satisfaction with the local area went from 50% to 80%. Now, you can't put a monetary value on that, but do you see how being able to show that, yes, we save money through doing this engagement, and on top of that, we've also seen a really impressive reduction or increase in satisfaction. That's a very compelling argument. And so it's about providing evidence in the business case for the value of what you're doing on many different levels. It's not just about just looking at the money, it's about getting across the board. And thank you, Annie, for posting the link to the toolkit. The link will actually follow a bit further on as well. So that's another great example of how you can make a compelling case. And And again, acknowledging that those Home Office figures are quite old, acknowledging that the bin fire statistic might not be perfect, but it's a much better measure than nothing at all. So the toolkit will help you figure out what are the costs that you can put money value on, what are the benefits you can put monetary value on, what are the costs and benefits that you can't express in monetary terms, and making sure that you don't discount those just because they're not pounds and pence. They're also very important. And just to take you through what that means is the first stage is to scope the business case. Decide how you'll use it, decide who your audiences are, and decide if you want to actually measure things in monetary measures at all. In some cases, you might not want to. But you need to be really clear about why you're doing a business case and who you're aiming it at. Are you aiming it at charitable funders? Are you aiming it at the internal audience within the council? Are you aiming it at central government? Who's going to read the business case? And that will help you decide who you aim it at. The second stage is defining your focus and purpose. So why are you doing the business case? What's the focus? What's off the table? What's on the table? What's the geographical boundary? What's the topical boundary? If you're a council project, are you even interested in crime rates or health rates or health outcomes? And then look for the comparator areas or comparator projects that you can use to make an even stronger business case. The third area is deciding what to measure. And that's where you look at this log frame and say, well, what can we put money, what can we count using monetary terms, what can't we? Who do you need to talk to get the data? What are proxies that are appropriate? Can you put a replacement cost on some of the things that you're getting? Can you find out how much complaints and the legal challenges cost? In stage 4, what you then do is you complete this online, the Excel checklist that the toolkit comes with, and you challenge it. You look at the data and your assumptions. You gather the data, you fill it in, and you then start to look and see what's this showing me. How can I improve the data? What else do I need to capture? And then you analyze the results, and you might want to look at social return on investment. So you might want to say, well, this engagement or this project is costing us is costing us £50,000, but the and what we're showing is actually health improvements which we valued at £250,000. Now, that means that you can say we've got a that means you've got a £5 for every pound you invest, you get £5 back. So that's one way of explaining these things to people in a way which can for some people sound more impressive than just saying we achieved savings of £250,000. Understand what the limitations are. Don't oversell your business case, because if people find you out, which they will, then it just devalues the whole business case, even if it was just one particular number that wasn't quite clear. And make sure you test the results with colleagues so that they understand, because they'll often discover that they might disagree with something that you've said, or they might interpret it differently. So just make sure you test things before you get it out to the public. And then the last and possibly most important stage is the presentation of the business case. What's the right presentation format for what you're trying to achieve in the audience? Present it and adapt the business case to fit the feedback. Because the whole point of writing a business case is to inform and influence. It's not just some academic exercise you do to prove something to yourself, to make a point. It's something that you're aiming to, whereby you're aiming to influence people's decision making. So looking at, here's a very interesting example for me. So probability. We talked about risk earlier. So how do you deal with a situation where the benefit of engagement is reducing the risk of catastrophic failure? So the Environment Agency builds flood defense schemes. And in one case, they estimated that the benefit of flood mitigation was 35 to 40 million pounds. And an engagement process for that area costs £2 million. Now, why do you engage around this thing? Well, the reason you engage around these things is because in some cases, in a small minority of cases, people appeal the flood defense schemes, and in the period of appeal, the flood happens and the damage of those 35 to 40 million pounds worth of flood damage happens. So what you're basically looking at is how many cases would engagement have to change from a no to a yes, and thereby stopping a flood from happening before the cost becomes 40 million and becomes more expensive than the benefit it's creating. So in this case, by dividing 2 million with 35 million, you come up with a figure of 5.7%. So what this means is actually engagement needs to change the result from rejection to acceptance in 1 case in 20 in order to be worthwhile. So that's just giving you a sense of when you're dealing with cases which are very different. You're engaging people around planning, you're engaging people around an issue where 9 times out of 10 it's not a problem. Then occasionally something really bad happens. And this is a way of making the case for why engagement should happen in every single case, even though it'll only be a problem in a minority of cases. And this is because the cost of failure is so high that it's actually worthwhile doing it for all projects. So, I've talked quite a lot. We've had a little bit of interaction, and we've got about 10 minutes left. And I just want to check if anyone has any questions or any problems or challenges that you are facing around the business case, convincing other people around public engagement. Do let me know if that's the case. Any hands, Annie?
We've not got any hands at the moment. I could kick off with a question, Edward. Oh, we do actually. We have Barbara.
Absolutely.
I'll give her the first go. Here we are. Hi, Barbara.
Oh, hello. Can you hear me?
We can hear you. It's quite faint, so if you could speak up, that would be fantastic. But go ahead.
No, I'll do my best. I'm sitting in a big open plan office. I work for a local authority, and what we're looking at the moment is how we can use engagement to improve services. So it's engaging communities to inform tender processes so that the tender designs fit the need of what people need, and then the final services hopefully are what's delivering what's required. So it's across a range of services, which is why I wasn't able to come up with kind of specific examples, but we're just trying to develop a kind of partnership, strategic approach to it for a borough, and also try to find sort of specific examples and services where we could apply and try it. So I'm quite interested in what you're saying in terms of trying to make the business case to engage services and engagement and to kind of quantify it in monetary terms, but also in sort of social and other benefits.
Sorry, it's cracking. I couldn't quite catch that. Did you hear?
Hello?
So can I repeat your question back to you, Barbara, and see if we've got it, just because the line's a bit crackly. So you're talking about how to make the case for engagement across a whole range of services. So perhaps you don't have the concrete examples of we've done exactly this and it's caused this, but a more general kind of making the case. Was that, have I got your question?
Yeah.
The gist of it? Okay.
Yeah, and because we're looking at the role of community engagement to inform service design.
So specifically looking at service design, yeah.
Well, luckily there are quite a few which have looked at developing some quite strong case studies where it's made a difference. And I'll include in a few slides, there'll be a few links to various studies. And so you can actually, there's a number of things you can draw on and point to, saying, well, actually, looking at engagement across the board, there's a number of case studies which have shown real benefit, and we think the same thing holds true in our local authority area. So you can obviously make use of other people's business cases and research to strengthen your hand by showing that in other cases, similar to yours, there have been studies done which show that the benefits have been achieved. Now the thing there is, obviously you won't have the money to do a full economic evaluation, but you can make use of other people's evaluations to do so. Quite here, it was quite cracked.
Does that answer your question, Barbara?
Yes, it does. That's very helpful. I mean, that's a good starting point.
Great. Okay. We've got another question here from Daisy. Hi, Daisy.
Fantastic.
Hi. I was wondering if you had any tips for encouraging organisations or individuals to think more long term about the economic benefits of public participation. And we've done a few projects where, in the kind of context of the tight public budgets, people are very nervous about doing, finding out kind of public participation over a longer time period, and that limits the benefits they can gain from a project because they come with kind of preconceived ideas about what they should do and what the timescale would be and who they should involve and that sort of thing. Yeah, so I was just wondering if you had any tips for further encouragement for those types of organisations.
Well, I mean, one thing is I haven't really had the chance to talk much about is the whole concept of theory of change, which can be a very powerful complement to a business case. So really setting out, well, what is the change we want to see over the longer term, and how does it all link? Because a lot of this, I've talked a lot about measuring things and metrics, but actually one of the key things that makes a big difference is telling a compelling story and being able to tell people very clearly, well, if this happens, then this is likely to happen. This is why we're doing it. And the longer term impacts, I mean, if you can draw on this case studies which show, if you can show case studies which would show massive impacts in the longer term, that can be very inspiring for people. But one of the challenges we do face right now is a very short-term pressure on funding.
Yeah.
Which means if you can point to shorter-term benefits in terms of reduced conflict, and as well as really long-term benefits, that's useful. That's a very powerful. That's very important today, unfortunately. Personally, I think there needs to be a way of developing. We need to start looking more long term around this, because, as you said, if you don't, there's a lot of projects that need to happen that won't get funded because our timescales are too short.
Yeah.
And in part, I mean, part of the thing is when you do your measurements and develop a business, you can also decide whether or not you want to discount benefits in the future, and at what rate. So a lot of economists discount the future very heavily, which means that benefits in the future count for far less than shorter-term benefits. But of course, you can, if you're able to make a compelling case for why actually we should be counting benefits in the longer term as significant as well. You know, you can challenge people. Where do they make the cutoff? Oftentimes they'll make a cutoff point which is quite short. So questions when other people present business cases, it can be quite a way of influencing as well.
Okay, great. Thank you.
Is that helpful?
Yeah, brilliant. Thank you very much.
So, I just wanted to say a few more words about communicating the result, because I think this is where, you know, you can spend lots of time developing a business case, doing work, but if you don't communicate the results clearly, the whole work will be of naught. And use the business case to tell stories about engagement. Tell a clear storyline of what's changing and how. Tailor your argument to fit your audience. If you're dealing with charitable funders, they will be interested in very different things than if you're dealing with a head of finance. If you're dealing with people who are working in the NHS, they'll be interested in different things than people working in the education system. Individuals will have very different things that motivate them. I've worked with council chief executives, and they've been like night and day. Some of them have been incredibly driven by values, others have been very driven by the bottom line. seeing is believing when it comes to engagement. So the best way to complement your business case is to get people to go out there on the ground and see your engagement as it's happening, to see that it's working, to see that it's changing things, and to see that it's a valuable contribution. Anecdotes can be incredibly powerful. So when I was speaking to the project manager in British Nature when they did the Humber Estuary project, what he was able to do, he was able to tell some really strong anecdotes about how his relationship with some of the key stakeholders had completely transformed through doing engagement differently. He was able to show how people just who weren't responding to his phone calls were now inviting him along to events, and they were on cordial terms. And on top of that, he could also point to these significant monetary savings. And that's just such a powerful way of communicating. It brings it to life. And above all, don't forget the costs of non-engagement. So oftentimes engagement seems expensive because we don't factor in the costs of not engaging. Because it's very rare that you can do nothing. If you don't engage, if you don't do, say, a participatory budgeting exercise or a co-production exercise, you might still have to go out and do formal written consultation. That comes with costs. Or you might have to do marketing or something else. There's costs of not engaging as well. And going back to that point about risks, that's important to articulate as well. And then you have the theory of change, which I think is a good model whenever you set up a project or an engagement process. What is the change we want to see in society? And drawing the chain from where we want to get to, what needs to happen for that to take care, and what are the activities that this project is taking part in which are actually contributing to that. That's really useful for you to articulate, and it's extremely useful in order to be able to tell others a strong, compelling story about why your engagement is worth spending taxpayer or charitable funding on. So those are some key points about communicating the result, because that's why we do business cases. Not just because they're interesting, but because we want to see a difference. And so here's an example, Doncaster Furniture Recycling project, where there's two very different types of benefit that they calculated. 488 tons of waste diverted from landfill. When you calculate that, so it's about £20,000 in landfill tax payments that the council avoided. And on the other hand, over 4,000 low-income households received goods, which, if they'd had to buy them themselves, would have cost them £140,000. Now, can you see how, depending on who you're applying for funding for, who you're trying to convince, you would use these arguments differently? If you're dealing with a charitable fund, they'd be very interested in helping low-income households. They're probably not interested in helping the council save £20,000 in landfill tax. Whereas the council, especially a councillor who's strong belief in market forces' ability to solve things, might be very interested in the first, but not very interested in the latter. So it's worth thinking about, what are the benefits I need to articulate? Can I put monetary values on them? If so, that's fantastic. If not, that's fine as well. And here are a few links, and I'll make these slides available so you can access them. But the Involve has the Making the Case for Public Engagement toolkit. It's also got an Excel sheet you can use. IDA, Democratic Society, and InHealth Associates have all done some very powerful papers on public engagement and the business case, making the business case. So those will all be available for you as well. And I thought I'd just finish on this note to say, go out there and do it. Have a go with a business case. It won't be perfect. It'll be vague. There'll be lots of assumptions in it. But it is better to be roughly right than precisely wrong. So I'm hoping I've inspired some of you to go out there and make a strong case for the work that you're doing, and that you're doing well, that you're better able to articulate these things, that you'll find the toolkits and links we've provided useful, and also that you'll tune in to the next webinar in 2 weeks' time, and there'll be more webinars after that. We've got some on community organizing, online engagement, and other things lined up. So it should be very, very good and very interesting. Any last questions?
Doesn't look like it, Edward.
Okay. Well, thank you so much for your time. Really it's always a pleasure running these things, and I hope you have a lovely continued Friday and a great weekend.